A caller from Washington. Go ahead, Washington, you're on the program.
Good evening. Thank you for taking my call. My concern and then my question would be, there's been, with healthcare reform, so much emphasis placed on, making sure folks are insured. But one of the greatest crises of this whole healthcare system that I see is accessibility. There are simply not enough primary care doctors. I know here in Washington, where I live, within the past year, we have lost 7 primary care doctors, and this is in a town of about 10 to 15,000 people. People are going to the emergency room to have their Coumadin checked, their INR, and this is simply not an appropriate use of the emergency room, but at the same time, they need to get their blood levels checked. So it's one thing to have the insurance, it's another thing to not have a doctor to go to. And, we're within 20 miles of ECU, which has a terrific medical school, which when it was founded, placed an emphasis on family practice and primary care in trying to plug people into rural areas. So my point in question is there not something we can do, such as they do with teaching fellows, where they help pay and offset teachers' educations if they'll agree to teach in North Carolina for so many years? Cannot that not be done with medical students? Could we not help offset some of their medical education if they would agree to serve in underserved areas in a primary care setting? I know cardiologists and gastroenterologists and surgeons make more, but we need family practice doctors. Thank you.
All right, thank you.
Well, the bill actually does have provisions in there to do just what this gentleman was talking about. The bill includes $1.5 billion over 5 years to provide loans and scholarships to healthcare professionals who agree to serve in underserved areas. That includes primary care doctors, but it also includes nurse practitioners, physician assistants. It also includes mental health professionals, because there's a real dearth of mental health professionals in the state, as well as dental professionals. And in rural areas, we have a lack of both dental professionals, mental health professionals, and primary care providers. And this bill does include legislation and includes money to help offset to help provide financial incentives for providers who are willing to practice in rural areas. Typically the way it works is they repay the loans that the health professional incurred during medical schools. For every year that they practice in an underserved area, they'll repay a certain percentage of the loans. So it does provide an incentive to go practice in underserved areas, but there's more. There's 2 other provisions in the bill that I think addresses some of the concerns that this caller raised. One is that it also provides some resources to create community health centers in communities where there are none right now. And community health centers have a mission and a legal obligation to provide services to everybody regardless of ability to pay, and they charge people on a sliding scale basis. And that can help address primary care needs because it's really focused on primary care needs. And then the other area is that there's money that is being put out under this bill and under prior legislation to try to increase the health professional workforce, including primary care providers. So in the next 5 years or so, we should start seeing more primary care providers and start seeing them move back, hopefully, into rural communities and underserved communities.
I agree with Dr. Silberman. I think the Affordable Care Act does have a lot of provisions in to try to provide incentives for physicians coming out of training to serve in underserved areas. What I wanted to add to her comments also were the fact that I think we're going to be seeing a lot more proliferation of physician extenders, mainly nurse practitioners and physician's assistants. And I agree completely with the caller. Very astute observations. I worked at ECU for several years in my earlier career and know very well the needs out there in rural eastern North Carolina. And you can go for miles without finding services, but it doesn't always have to be a physician, particularly when it's routine matters like what I was talking about earlier in primary prevention. those things like the well-child check, for example. Even if you have high blood pressure, coming in and get your blood pressure checked and making sure your meds are regulated and so forth. You do not need to see a physician at all those visits. And I think what we're going to be seeing more and more of is a proliferation of physician extenders doing more primary care.
Do you mean physician assistants, nurse practitioners, things like that?
That's what I mean by physician extenders, yes.
All right.